Hello everybody, welcome to the presentation, Dietitians, Eating Right, Feeling Right, and Living Healthily. My name is Dimitrios Panos, and I am the program lead for the program Dietetics and Nutrition at SIT. And I'm here today to give you some details about the program. You probably already know that this is a relatively new program, and it was developed in collaboration with MOH and the chief dietitians at the three major clusters, health clusters in Singapore, because there is a demand and there will be more demand of dietitians in Singapore. The reason is that the population in Singapore is aging very, very fast. And the aging population will escalate the prevalence of chronic conditions and the challenges that will come along with this increase. So we will need more dietitians to provide support to ensure the quality of life of those who are at senior age. So what do dietitians do? We are qualified to apply scientific knowledge of human nutrition to maintain and promote the health of individuals and in the community. We are qualified to manage and treat medical conditions. So we can provide nutrition care for acute and chronic conditions. We are the consultants on all aspects of nutrition care in different settings, from hospitals and nursing homes to food services and community and public health. Where do we work? We can work in acute hospitals, in community hospitals, in private clinics, in rehab centers, long-term care facilities, nursing homes, food services, research and teaching, policy making and public health, and we can be consultants for the improvement of the performance of athletes. The exciting thing about being a dietitian is that we can provide advice and nutrition care at different stages of life. So we have dietitians who are specialized in providing advice in pregnancy, in pediatrics, in adulthood, and in senior years. So as dietitians, we can provide nutrition care and medical nutrition therapy for specific chronic conditions. We can assess our patients, we can make a nutrition diagnosis, we can provide intervention and treatment, and monitor the progress of our patients. We work together with other healthcare professionals to ensure the quick recovery of our patients. Some of the conditions that we can provide nutrition care include diabetes, heart disease, kidney issues, weight management, of course. We work in food services in hospitals to ensure that we provide nutritious meals, that the meals provided to our patients follow the specifications of therapeutic diets. We see patients with digestive issues. We provide nutrition support to those patients who are at risk of malnutrition, and we do see surgical patients. Some dietitians decide to work in research, some dietitians provide teaching, and of course we are involved in public health and community care. We have the skills to empower people to make a change in order to recover very, very fast and holistically if they suffer from acute or a chronic condition. We also see patients that there are so many areas actually that we can provide expertise, including liver disease, eating disorders, patients with hypertension, neurological disorders, allergies, patients that they suffer from dementia, osteoporosis, and of course transplantation. And of course, I cannot forget to mention the important role of dietitians in the pandemic. We had dietitians on the front line. We provided care for those that they suffer from COVID-19 and they were in critical care and they were at risk of malnutrition. We helped people to get back on their feet as part of rehabilitation. We supported vulnerable people with technology. So there were people during the pandemic that they suffer from a chronic condition that they couldn't see their healthcare team as they used to see at the same frequency. So we provided consultations through telehealth. We supported public health by making sure that we work on health promotion messages that will help us to have a strong immune system to fight the disease. And of course, like with any other condition, we worked on tackling harmful myths. Practice and research in dietetics is evolving, especially the last couple of years, and we can see a huge acceleration in the next 10 years in these areas, research and practice. And you, as students, will be part of that journey. You will see that dietitians are involved in research that explores sustainable environments. We are working in research to ensure that we have interventions that can facilitate the quality of life in the aging population. Of course, we're working on new weight management interventions. These are some examples that I have here. You've heard already about plant-based proteins. We are working on digestive wellness. Mental wellness is very important at the moment. And of course, there's a lot of research looking at nutrigenomics and nutrigenetics and personalized diets, and of course, digital health. And I have a wonderful example of what is happening in Singapore. For example, Dr. Lim Su Lin, who is the chief dietitian at the Department of Dietetics at NUH, that she has worked with her team to develop an application that we can use in our phone to control diabetes. So we can see that actually dietetics has expanded to so many areas, which makes it even more exciting. Here I have how the curriculum looks of the program, which, as I said, was developed in collaboration with the chief dietitians from the structured hospitals in Singapore. So we have in the first year a lot of common modules, such as anatomy and physiology. These are modules that a lot of other students from the allied health programs also do. Health system, Singapore's perspective. Then slowly, we are moving into more specialized modules, more relevant to dietetics. So for example, nutrition, health and disease, nutrition assessment. And at the end of year 2, you will have an opportunity for the food service placement, which is 6 weeks. Then year 3, we have even more specialized modules, such as medical nutrition therapy 1, medical nutrition therapy 2. And this is at the end of the year 3, academic year 3, this is where you move on into your second and third placement. And finally, at the beginning of your year 4, you have your last placement. And of course, we work on the honors thesis preparation from year 3, trimester 2, and we are moving into the actual honors thesis in trimester 3, and submission is trimester 2 in year 4. I want to explain that actually we have 3 placements as part of our curriculum. So we have the first placement, which is food services management, which is 6 weeks. We have 8 weeks of community and public health placement. And then we have the clinical placement that focuses on individual dietetic case management, 6 weeks and 12 weeks. So altogether, we have 32 weeks of placement. We are very proud in SIT and in dietetics and nutrition program as advocates of applied learning. So we do have, for example, in the year 1, labs for biochemistry and food science. And of course, we have our kitchen lab for some of the modules. And of course, we do have simulation labs that we use to train our students, but also to assess their skills. So the students in this program, they will have the opportunity to practice what they have learned in a safe environment, in the class. And of course, as I said before, we have our kitchen lab where the students will be taught and they will practice how to develop menus for patients that they suffer from specific conditions. So they will see and they will learn and they will practice the specifications of therapeutic diets. And as I said before, the best example of applied learning is when we do our clinical practice, our placement. So we have the food services placement where you're going to learn about hospital menu planning, quality management, project development. Then we have the community and public health nutrition where you're going to learn more about health promotion, needs assessment, policy making. And of course, we have the clinical placement, the last one, which is going to focus on the nutrition care process and medical nutrition therapy. The career pathway for dietitians is exactly the same as the rest of the allied healthcare professionals. So you start from allied healthcare professional as 2, and then you can go up into, who knows, you can even become the director of allied health services one day. In this slide, we see the admission criteria for the program. For A levels, we are looking for a good pass in 2 H2 subjects, preferably chemistry and biology. In polytechnics, for polytechnics, we are looking for an approved diploma from a polytechnic in Singapore, preferably related to life sciences. For IB, we're looking at a good pass in 2 HL subjects, preferably chemistry and biology again. And NUS high school diploma, major cap of at least 2.5 in biology and chemistry and mathematics. Now, once you submit your application and you meet the criteria, you will be invited for multiple mini interviews. And if you are successful, then we were going to go move forward to medical examination. What we are looking for is that we are looking for candidates that they have good decision-making and judgment capabilities in order to become dietitians. The ability to motivate and guide others, the ability to identify and solve complex problems, being socially perceptive, good reading comprehension skills, resilience, effective logic, reasoning, and critical thinking skills, effective writing skills, effective communication skills, and active listening skills. But if you don't have the skills, you shouldn't worry because we will train you to develop these skills. In the end, you will all develop the qualities of a healthcare professional. You will be caring, you will be compassionate, you will be people-focused, empathetic, resilient, ethical, and inquiring. Of course, we do have an overseas exposure program, but unfortunately, because of the epidemic, that program was frozen. So we couldn't send any students during this period of time. But these are pictures from other students from the past times that they visited Hong Kong, Japan, Shanghai, Switzerland, Taiwan, and Thailand. Some information that you may need to know, that admissions and intake is once per year. Your application should be submitted by 11th of January to 19th March of 2021. Interviews will happen probably between mid-March to mid-April 2021. Offers and acceptance by 24th of May 2021. Matriculation will happen June 2021. And I just want to also say that we have a great team being involved with teaching in this curriculum. We have experts in nutrition, but also experts in so many fields that they add so much value with teaching in dietetics and nutrition. And also we have invited lecturers from the industry. So we do have dietitians, clinical dietitians, that they come and they teach in the curriculum and they share their experience and they tell you exactly what works with the patients and what actually wouldn't work and what do we need to change to ensure that we provide holistic care for our patients. This is a picture of the 2019 cohort. They do have excellent communication skills. They are very good advocates of health promotion. They have their own Instagram account, which is called SIT-DTN, where they actually publish healthy recipes or share information about nutrition to the public. They are involved in several health promotion initiatives that we have in SIT, such as, for example, we celebrated the World Heart Day, we celebrated the World Diabetes Day, and of course they, sometimes I ask them to accompany myself when I do some activities in the community, and they are involved in what I do in the community. For example, I've been involved with the Singapore National Stroke Association, where I did a talk there, and the students were involved, and they were part of that talk. So they always have some opportunities to practice what they learn, even if it is not part of the curriculum. So thank you very much. If you have any questions, please do not hesitate to ask us questions, and we are looking forward to see your applications.